All right, welcome, my friends, to episode 693 of Extreme Health Radio. Dude, we're closing in on 700 shows. Can you believe that? That's crazy to me. We started this show in 2012, back when podcast was just kind of new, and it's an amazing journey we've been on. And during that journey, we've learned a lot about health, and you can listen to our previous shows and learn a lot about our journey as well. And one of the things we've learned throughout this whole process is just how important oral pathology is on our health. And not a lot of people realize that there's connections to cancer, there's connections to different diseases based on mercury fillings you may have, or cavitations, or root canals, or any gum disease. All of these things reflex to different organs of the body. And through the Chinese meridian system, each tooth reflexes to an organ, and every organ reflexes back to a tooth, which is just crazy. And so when you understand the interconnectivity of the body and how everything is connected, you start realizing that on a deep level, on a deep physical level, the oral pathology and your oral health is intricately tied to how healthy you really are and how much energy you have. And this is why we like to focus, even though it's not that sexy, it's not that exciting to learn about health from oral perspective. But man, when you start getting rid of these things in your mouth, this is why it's one of the most foundational things that I always recommend everyone in our Extreme Health Academy to do is before you start changing your diet, get the mercury fillings out of your teeth. You know, before you start worrying about XYZ health condition, get that root canal out of your mouth. And so we talk about that with Dr. Stuart Nunnally, Dr. Lane Freeman, and Dr. Candace Owens, who are just amazing people at healthysmilesforlife.com. And I highly recommend getting your oral issues fixed by a biological dentist. Superly, critically important to make sure that your oral pathology and your oral health is on point, and there's no issues with it, because man, this affects your overall health like in ways that we don't even fully understand yet. And so in this interview, we talk about fluoride, we talk about cavitations, we talk about mercury fillings, we talk about root canals, periodontal disease, gum disease, and we also talk about ways to maintain your oral health as well as ways to reverse these conditions as well. So this is a really great episode. Please share it with a friend if you would. I'd greatly appreciate that. And again, I'll put the links to everything at extremehealthradio.com/693. That is his website and their website where you can connect with them. And just so you know, Kate and I and the kids, we drive all the way from California to Texas just to go to a dentist, to go see Dr. Nunnally and get everything done correctly. I cannot recommend them enough. Amazing group of people over there. And that'll be an experience you probably have never had before at a regular dentist. So great people over there. And we'll link everything up in the show notes again, which is extremehealthradio.com/693. All right, guys, I hope you enjoy this episode. We kind of start off with Kate talking about the big C, little v and how that's affected their practice. But I hope you enjoy it. Pass it on to your friends, and I'll see you at the end of the show with a little wrap up. Enjoy the show, guys. Thanks for joining us. My goodness.
I'm curious, has the virus thing deterred people from coming in for regular checkups and cleanings and things?
It has. We've got such a broad range of patients for in any given time in the office, we'll have some people who are just, until the mask mandate was lifted, or just were so done with the masks and really were not concerned at all. But then we did have, especially with our elderly population, there was a lot of fear that they had. And also those from big cities or from other states, they were constantly being fed this fear narrative. And so a lot of them were concerned about coming. We had a few that decided not to come at all, but we tried to be a place of calm there and telling people it's going to be okay. It's really okay for you to have your mask off once you're in here and everything. So, but it definitely, we still have a few that are just saying, I'm going to wait a little bit longer, but those are mostly, I think, in the elderly population.
Mm-hmm. Yeah.
Our patients from abroad have just pretty much been locked down. We've hardly seen anyone from Europe in a year or any of the other countries. It's just, we're sorry about that because we so enjoy them.
Wow. That's crazy. Yeah. There are a lot of, I've heard different, I think China is now looking at doing, vaccine passports or something at different locations, different airports throughout the world. And it's really quite strange, everything that's going on. Because a lot of, like, what percentage of your clients do you think are international? Quite a bit, right?
I would think probably in the neighborhood of 10%.
Yeah, I think so.
When it's open,
I agree.
I would say.
Yeah.
Yeah.
Yeah. Well, I'll never forget, Dr. Freeman, when I saw you in 2010, I had heard about your practice for a lot of years before I went, but I kept hearing on and on about the importance of making sure that you don't have dental amalgam fillings in your mouth. And I was on my health journey from 2003 to 2010. I was doing a raw vegan diet. So I'd been into health since 2003, just studying and learning. And I was constantly trying to improve my health. But then I realized all the while I've got this mercury, which is the second most toxic metal in the world, in my mouth. And in 2010, I remember Kate and I flew out to your location and you removed all of my dental amalgam fillings. That was amazing.
Well, that was a privilege to get to take care of you. I cannot believe that it has been that long.
I know.
I mean, none of us have gotten any older, so I can't believe that it was 10 years ago. But yes, that was good.
Yeah, and you guys, I would imagine a big part of your practice is removing amalgam fillings, right? It
is removing mercury fillings and doing it safely. But also a lot of other material, other restorations like crowns that have metal substructures in them. That's usually, base metals. And a lot of times there's mercury underneath those crowns. Not always, but sometimes as well. So we do a lot of that.
Wow. That's amazing. And
can I jump in real quick? I was so curious to ask maybe Dr. Owens, but when you fixed our friend Jan's cracks and things that had chips, I'm not sure exactly what she had, but, is that as important as an amalgam situation with what is going into the fixing of people's teeth with emergencies and things?
Definitely. We take, really seriously what type of restorative materials we're going to use. Your friend having something in the front where we were doing a white resin composite material, we still use the materials that are most biocompatible for the majority of people that we see come through. And then especially, when we have women who come in who are they're of childbearing age, they also want to be really particular about some of those components, things like BPA, don't necessarily want that in their fillings or in their children's sealants. So the replacement is just as important as considering that those amalgams are 50% elemental mercury.
Mm. Do people come in a lot for restoring that kind of work, or is it more amalgam removal and things like that?
Yeah, I think, we are blessed. We see patients who have a lot of knowledge, like people that listen to you guys' shows about their health and wanting optimal wellness. But then we also have patients that have known Dr. Nunnally and Dr. Freeman for many years in the community and just trust them with their general dental care. So if they are having accidents that require replacement or, just good old general maintenance dentistry, we do all those things.
Oh, cool.
Yeah, it's really important, isn't it, to make sure that the materials you're using are biocompatible, because you guys actually do blood tests, right, with people, and to make sure that you're not putting something in that may be a replacement. It might be good for someone else, but may not be good for the patient. So you have ways of testing, right, to make sure that it's compatible, right?
We do have ways of testing. You can certainly do a blood test, and one lab that we've enjoyed working with so much over the years has just recently decided to close, and that's disappointing to us. We've sent hundreds and thousands of serum samples from our patients to that lab to determine what materials were compatible. And the good news is, even though they have now closed, is we have 20 years really of track records of knowing now what materials are most biocompatible for patients. Mm-hmm. And so we're very, very careful about that. And, some of our patients come from physicians and other healthcare providers who have other ways to determine the compatibility of materials. They may test those materials by muscle testing. They may test them by acupuncture type means. And so those things are legitimate. They're not very well known still in this country, but they're very commonly done in other parts of the world. So I think the main thing is for the dentist and the patient just to be cognizant and be as informed as possible that, yes, you can get dental materials that are not biocompatible. And we've used them for well over 100 years. Mm-hmm. And it's something that I think we as dentists should be a bit embarrassed about, because there are other options available.
Mm-hmm. Mm-hmm. And especially now with the ability to test in multiple ways, that's probably got to be an issue with a lot of people, I would imagine, if they're getting some material in their bodies that's not biologically compatible. That's going to put a burden on the immune system, right? Have you guys seen a lot of that, where people get something and you find out later that maybe a previous dentist put something in that wasn't biologically compatible? Dr. Owens, I'm sure you guys have seen that, right?
The first thing that comes to mind for me is a number of the patients that Dr. Nunnally will remove titanium implants on. Oh. That's probably the biggest culprit. Is someone will report after they have the implant, they're excited to have their root canal removed, but then they get this implant and they'll begin to realize it's not agreeing with their body. It's obviously very individual, but their energy levels, and he can probably speak to more detail. And sometimes the patient they cannot tolerate that material. They either need to have it removed, or it might have been a better direction for them to have something like a zirconia.
Uh-huh. Hey, Kate, share your story. Because remember when we went for the first time, I think, and you got a bunch of work done. I forgot exactly what you had done, Kate, but you had some blisters or warts on your thumb.
Yeah, my whole entire left thumb, and then beginning on my other fingers, like around the knuckle area, it was starting to fill up with like these skin, I don't even know what you call them. They almost looked like a boil wart situation. I had gone to the dermatologist. They said they didn't know. They burned them off. They came right back, that kind of thing. And it had gone on for a couple of years, and I was starting to get really upset because it was starting to grow on my hands and take over a part of my hand. And I came and got, I think that was the root canal visit where I had the root canal tooth removed. And I'm not kidding. I thought I was going crazy within 3 days. I go, Justin, am I crazy, or is this like fading and going away? He goes, no, it looks like they're like shrinking.
I said, no, you're crazy.
Yeah. I'm like, I think I'm just like wanting to believe that this root canal thing could be that big of a deal. And within a week and a half, I mean, they were flat, but they still had the marks, and it probably took a good 2 years for those to fade. And I mean, it was right after my root canal removal.
And you'd been trying to work on them for a while, right?
Oh, it had been probably a year and a half by the time they started to when they looked really, I thought I was turning into the elephant man. I don't know what that was, but obviously it was very connected to the removal of that. It was quite, it was really cool to be able to tell. A lot of the people that we talk about with products, with saunas, they say, what do you see? And I go, well, it's more how I feel, but I can say with the root canal removal too. I mean, I saw it. There was physical evidence. It was amazing. If
that was a viral infection or some sort of, virus, sort of spreading throughout your body, could the teeth impact that? Could that be impacted by the teeth, you think? Or, I mean, it seems weird that would be a coincidence, but, Dr. Freeman, do you have any ideas about what could have caused that or prevented that from growing?
Well, as we've, learned so much that the entire body is connected. The mouth isn't something separate. So anything that's in the mouth can affect the rest of the body on a fully systemic level. And also anything going on in the body can affect the mouth. We see those effects. And so when you recognize that, I think all of us would agree. We've stopped saying, oh, there's no way that can be related, because we have seen some crazy things just like that, Kate, with your description, where in my head, I might be thinking, I just don't think that that's really going to tie in. But we'll have patients call back all the time with random ailments that'll say, hey, I wasn't even expecting this, and I got this result after either having heavy metals removed, or especially with root canals and all those hidden infections and the toxins that come off of that. They just travel throughout the body and affect people differently.
And, oftentimes we see those manifested as lesions on the skin. And it's a great place to detox. It can work its way out there, and it's one of the ways that the body has used forever to get rid of toxins. And so it's interesting too. Sometimes, Kate, when we remove the dental toxins, the body will begin to really release them, and we'll see, even for days or sometimes even weeks after, we'll see bumps arise on the skin. And it's a method that the body uses to detoxify those toxins, and then they typically clear up after that. So that's not an unusual thing for us. And we just like Lane said, when we first started realizing that people would have those sorts of systemic results, as a result of dentistry and removing the toxins. Sometimes we could hardly believe it, but now we believe it.
Yeah. It was super encouraging to me, because I was at the time going through a lot of digestive stuff, and I thought, my hope and prayer was that the digestive stuff would simmer down and stuff. I didn't even think about the lesions or whatever you want to call them on my hand. I had and then when that started happening, I'm like, this is what I least expected. I wouldn't have, and I knew a bit about health, but I still wasn't going to put that in that category. And it was shocking. It was super cool. Yeah.
Do we know, going back to sort of like mercury amalgam fillings, someone mentioned to us recently that, dentists are not, conventional dentistry is no longer doing the amalgam or the mercury in the fillings, but it's my understanding that there's still, there's a supply that most dentists will get. And so they're not adding more to the supply, but still dentists are still using what's out there until that runs out. And then they're going to start doing more natural substances. As far as conventional dentistry goes, do you know, are they still doing mercury?
I think there are definitely still some conventional dentists that still believe it's okay to use it. It's easier to use. It's cheap. And so there are definitely, unfortunately, a lot of times I think in lower income populations, you'll see that being used more, and also still in children, unbelievably, mercury is still used. Amalgam fillings are still used. There are, I think, more and more conventional dentists are moving away from it, simply because the patient population is more informed. Even if someone doesn't realize that a mercury filling maybe is toxic, people still don't like how it looks. So it's it's really being consumer driven, patient saying, I don't want that. So I think that's forcing some conventional dentists to switch over, but it's unfortunately still being used.
Do we know what other metals are in that? Because it's not 100% mercury, right?
No. It's silver and tin and zinc and copper and mercury. Mercury is about 50% of it.
Wow.
But the other metals are, silver typically is not really a big issue in terms of biocompatibility, but tin can certainly be. I mean, who wants to have anything out of a tin can, for Pete's sake? Or zinc typically is okay, but copper can really be an issue for people. Yeah. So the problem, though, is the mercury, and that's the one. For years we just chose in dentistry to call it a silver filling. Well, we should have been calling it what it really was, which was a mercury filling, and trying to do better and use something else.
There's a famous video I'm sure you've seen it, where it's like, it shows the mercury being exposed to, I think maybe heat or chewing or something. And it shows the vapors off gassing when someone chews. Do you know what video I'm talking about?
I think we do. Yeah. The one where they were holding it in front of a screen and you can actually see the smoke coming up. I think they had rubbed it with an eraser maybe to mimic chewing function and to heat it up just slightly.
Yeah, it's amazing. So people that have mercury fillings, those are off gassing, I would imagine, every time they chew or drink like coffee in the morning or something, right? Constantly. And if you think about the number of times your teeth just come together, even when you're not chewing, then that contributes to it. And then the fact that it's a metal and it expands, and then contracts when you have changes in temperature in your mouth. And,
so you're getting a constant outgassing with the constant release of that mercury vapor.
Dr. Owens, do you see a lot of people that that have to get work done for a second and a third time, maybe a root canal that the conventional dentist did, or a mercury filling that broke? I'm sure people have to get these replaced, right, over time, quite often?
Definitely. What Dr. Freeman was mentioning about the expansion and contraction, aside from those amalgam fillings having unfavorable materials in them, they can be really destructive to your tooth. I have some experience with having worked in public health. And she's exactly right. Whenever I was doing public health before I was blessed to meet them, that really was all we had in the clinic. I had to encourage them to bring in some more biocompatible materials as they started to educate me, and I was kind of transitioning. Mm-hmm. But it's sad because you've got somebody that maybe doesn't have a lot of access to care in that situation. You're putting in something that's going to lead to other treatments that they can't afford, like fracture of the tooth or stress to the nerve. And it can cascade, going from that big amalgam to, oh, well, now you need a root canal. Let's put a crown on it. But that can still fail. It has a poorer long-term prognosis than something that doesn't involve a root canal or maybe a zirconia implant. So it is all pretty intertwined and can be really rough on that tooth.
And I imagine, go ahead, Kay.
We'll finish your thought.
No, I was just imagining the long-term impact of having like mercury or tin and silver and copper and things like that in your head. Like, let's say someone has 3 or 4 or 5 of these mercury fillings. What impact is that going to have on them when they're 70, 80, 90 years old,
Remember our little neighbor? I was thinking about this going to bed last night. About 3 doors up, there was this little girl. It was Dante's daughter. She was about 4.
Oh, right.
Oh my gosh. She had to be 4 years old, you guys. And her entire, everything you could see in her smile line in the top was gold. They had, she looked like a rapper, not in a good way. Beautiful little girl, 4 years old with gold teeth. And we're like, oh my gosh, what? First of all, what happened? Second of all, who does that kind of work? It probably was, unfortunately, like a budget thing. But I'm thinking, oh my gosh, she doesn't even have her adult teeth. What is this about? And what's that going to do to her?
It is very overwhelming because you guys, I know from Instagram, I haven't met your little boys, but you've got these 2 beautifully healthy twin boys, and they probably eat a really wonderful diet intentionally that's important to you. But whenever I was around a population of patients that either didn't have access to, because we all know there's like these food or nutrition deserts, there's places where they don't even have easy access to fresh food. And then a limited education level or advocacy, on the parts of the moms to be able to say what they would like for their child. These kids eat a crummy diet and they come in and they get their Head Start exam, and all of a sudden there's all this decay. They get sent to a pediatric dentist, and then I would see them back exactly like you're saying. It was heartbreaking because they would just have wall-to-wall nickel crowns, or like Dr. Freeman said earlier, it's easier to place these amalgams. They're not as technique sensitive, but it's the worst thing on the planet. You would never let that happen to your little boys. Let somebody put mercury in the floor of their mouth. So it's really more than a health issue. I think it's, to a certain level, it's a justice issue that there's people that are not getting a high enough quality of treatment.
What happens in those situations with little kids when they lose their baby teeth then? What kind of impact is that going to have? Because they're obviously growing new teeth under that.
Yeah.
So in our system, I'm sure.
Sure. It's sticky. It would be great if they could just have that better nutrition and education to not develop the tooth decay in the first place, because it's not ideal for a little child to have a bunch of teeth taken out and then not have the proper spaces to be able to let their adult teeth come in a healthy dentition for their chewing and their airway and all those things that are so interrelated. But then it's also overwhelming to think about them being so little, having that much nickel or mercury or baby root canals. It's a hard thing.
I wonder what the blood-brain barrier, Dr. Nunnally, do you know, is that fully formed by a certain age? Because I wonder if a child, 4 or 5 years old, has these metals in their teeth. What is their blood-brain barrier like at that age, I wonder?
should be a good barrier, even at that age. And
Okay.
I don't know. I'm not sure. That's a great question. I think it's pretty well formed, but that's the problem, though, is with mercury, is there's not a barrier to mercury. The blood-brain barrier is certainly no barrier to mercury. And the placental barrier is no barrier. And so that's the real problem, is mercury is something that we as dentists should just abandon and confess up front, hey, we made a mistake. We never should have used it, and get on with life. But instead, we've continued to hang on to something that any layman on the planet knows is toxic as the devil. And we just have failed to abandon it and move on to much better materials, mainly exactly because of what Lane and Candace have just said. It's so easy to use. A blind monkey can put one in. And so we're just, and the problem, what's going to happen is, Justin, is even when we quit using it altogether in this country, see, we're going to ship it to other countries. And then I'll never forget this. One time, many years ago, this was probably 15 years ago, one of our trade dental journals had an advertisement in there, and it showed what we as dentists should do, and they labeled it with our scrap mercury fillings that we take from people. And they called it in the ad, in the journal, this is what to do with your toxic waste. Oh, by the way, that ad was only run one time, I think. But it was an ad for recycling your toxic dental materials into new mercury fillings. Yeah, it was, I don't know who the clever marketing agent was on that one.
They got fired, I think, the next Monday.
Exactly.
All right, guys, I just want to take a little break from today's show and tell you about molecular hydrogen and this really amazing product that our friend George Wiseman has created called the AquaCure machine. And this is a technology that's relatively new, although hydrogen obviously has been around in the universe since its inception. But molecular hydrogen, and aka Brown's gas that is used in this machine, helps to create the fourth phase of water, and it actually helps improve and repair your mitochondria. This is amazing technology, and I'm really excited to be able to offer this device to you. Check out what our friend Brian Hoyer has to say about it.
And then there's other mitigation strategies that I'm working on for outdoors, and there's different things you can do to mitigate some of the damage. You know, one of the things that Dr. Mercola recommends is molecular hydrogen, and that's actually been shown to basically mitigate 80% of the damage of free radical peroxynitrate, which stimulates those, which is created from the stimulation of those voltage-gated calcium ion channels. And so drinking molecular hydrogen when you're acutely exposed to those frequencies can help.
So yeah, that's what he's talking about. Oxidative stress. If you're in a non-native EMF environment that's full of Wi-Fi and cell phone towers, or if you're on airplanes or driving in cars a lot, this is really important to make sure that you're lowering that oxidative stress. And that's what he was talking about there. And here's our friend Nathan Walls talking about it as well.
You know, getting healthy sun exposure can do more than any supplement. I do take some supplements. Most of the supplements I take are on the short term. When I fly, I do molecular hydrogen because that's really a good quencher of free radicals, especially a lot of the free radicals made from EMFs. And when you fly, you get exposed to a whole bunch of EMFs. But here's a hack, because molecular hydrogen is not super cheap, but your body also makes molecular hydrogen. And the best way to do that is by getting infrared light on your gut. So that light, it penetrates into your gut, and your bacteria are able to liberate or pull out molecular hydrogen from your food.
Yeah, it's incredible, guys. I would really highly recommend listening to the interviews we've done with George Wiseman. I believe there's 2 of them so far on our store, biochargeme.com, as well as the head of the Molecular Hydrogen Institute, Tyler LeBaron, and he talks about how it's 400 times smaller than vitamin C, 700 times smaller than CoQ10. So it's able to actually get into your DNA and your mitochondrial DNA and repair your DNA. I mean, that's incredible. It drastically reduces oxidation and rust due to iron poisoning. It's able to get in places in the body that nothing else can get to. It's the most powerful antioxidant. There's over 1,000 studies on this thing. And what I love about George's machine is that it's affordable, but there's also a discount too. We give you 10% off. So if you guys are interested in this technology and bubbling water and drinking hydrogen-rich water, you can do it in your bathtub as well. You can do spot treatments of anything that's on, let's say you've like torn ACL, or let's say you've got a skin condition or something. You can do spot treatments with hydrogen gas right on a certain area of your body. You can put the thing over your eyes if you've got issues with your vision. I mean, there's so many applications and uses, as well as just breathing it like I do every day. This is an incredible technology, guys. I mean, getting into the DNA and repairing your DNA, that's healing at the fundamental level. So check out the AquaCure machine. It's available. There's a discount for 10% off at biochargeme.com. And here's a little snippet from our friend Dr. Donnie Wilson talking about aloe vera. Amazing, amazing food substance.
You know, we can talk more about this. What do I do to help people speed up the healing of leaky gut? I mean, you mentioned aloe before, and that is one of the herbs that I definitely recommend, using for helping to heal leaky gut. You want to use herbs that are anti-inflammatory and soothing and healing to the intestinal lining. So aloe is a great one.
Yeah, aloe, you're looking at, if you want to heal your gut, you're looking at colostrum, which is available from Thrival in our store, aloe vera gelatin. These types of compounds are incredibly important for healing the gut. But aloe vera's got over 75 active compounds. It's just loaded with vitamins, minerals, enzymes, amino acids, unique sugars like polysaccharides. It's anti-cancer, it's antibacterial, it's antifungal, it's antiviral. I mean, it's an immune stimulator. It's incredible. And what I like about Stockton Aloe One is that, unlike the stuff at the grocery store, it doesn't have any excipients, doesn't have any other tag-along ingredients. And it's raw, it's hand-harvested, it's unfiltered, unprocessed, unheated with no preservatives, no chemicals, and they ship it right after they harvest it, and they ship it to you fresh, frozen. And so I would get on, if you really want to improve your gut health and you really want to see some dramatic improvements in your motility and gut health, try some of the Stockton Aloe One. Get on a little protocol. Do it for 30 days and see what it will do for you. It's incredible. Take it like 1 to 2 ounces in the morning, 1 to 2 ounces in the evening. Start out slow and then work your way up to a little bit more. This is incredible stuff, guys. So make sure to check out Stockton Aloe One over at our store, biochargeme.com, or for the episode for this page, which is extremehealthradio.com/693. Hey, Dr. Nunnally, on our show, quite often we do little commercial spots, and we're going to put those in post-production on this one. But I often run your commercial because you talk about sauna therapy and, your story of toxicity, when you first sort of woke up to all this many years ago. For people that haven't heard that, share a little bit about your story and the progression of what you thought you had and you were almost diagnosed with. And how you overcame that, because that's pretty amazing.
Well, close to 20 years, I guess about 20 years ago today, I was convinced I had ALS. I didn't have ALS. I had a mercury toxicity issue. I was referred to the ALS Center in Houston, thinking that I had it. My neurologist, I think, was convinced that I did, and at any rate, I fortunately went to Montreal. I called the old grandfather of holistic dentistry, whose name was Hal Huggins, to see what he would do, and he said, "Well, I'll be in Montreal in a few days. Could you meet me there?" And sure enough, I went. I'd never met the man. In Montreal, I had all of my dentistry redone. But because even the white materials that we had put in, I had changed the mercury out over the years. My partners had, but now we didn't know anything about at that time that you could do a serum test and determine what dental materials were biocompatible for each person.
Wow.
It turns out all the materials in my mouth were uncompatible. So we just redid them. And, had a wonderful 10 days there with this Dr. Huggins and formed a friendship. And was so impressed with his breadth of knowledge. And but one of the things he recommended for his patients was getting in a sauna. And an infrared sauna was his choice. And so when Rebecca and I came back to the U.S. from Canada, we purchased one. And it was interesting, Justin, I had lost my ability to sweat. Sometimes that happens with people who have a heavy metal toxicity issue, especially mercury. And it took a while. But after I finally broke through getting in that sauna day after day, it was a huge factor in my ability to heal. And so I'm very, very grateful for what the sauna did for me. And Rebecca, of course, enjoyed it immensely as well. I think it's, in parts of the world, especially Scandinavia, they're used routinely. And I just think it can be a great modality in terms of healing.
Yeah, it's amazing. So for many years, you were removing mercury fillings before you knew any of this. I guess you would say incorrectly, right?
Absolutely incorrectly. Yeah, there's no getting around it. Yeah. No, I took them out, and I took no precaution whatsoever myself.
Wow.
Of course, now we all look like spacemen when we work and do these, and space women.
Yeah.
And we because we're not going to run that risk anymore, and I'm living proof of what it can do to you if you sit in that little mercury vapor fog for 20 years. And Justin, it's something, but dentists have a terrible neurological track record, and we're number one in a lot of things we don't want to be number one in, like suicide, divorce, depression. We lead the pack. I think it's from being exposed to mercury during our working careers.
Mm-hmm. Yeah. Wow, that's amazing. And so many dentists don't understand. Like, it's wild to me that a conventional dentist would not realize and understand it. I mean, what happens when you take someone's mercury fillings out, and just a conventional dentist, don't they have to use like a hazmat, and get rid of it as biological waste? And it's a big deal to get rid of it, yet they're not thinking to themselves, if it's that big of a deal to get rid of it, how come I'm not protecting myself when I'm doing it,
It seems absurd, doesn't it? Lane, why don't you answer that?
Yeah, it really doesn't, it doesn't go along with any logic. And, most of the patients that come to us are already very well educated on the topic of mercury, especially if they have quite a few of those fillings, but especially early on when you kind of had to be careful how you said things regarding mercury, really sharing that logic with patients and going, hey, if I take out your filling and I have big enough pieces that come out, because you usually can kind of, as Candace was saying, they pack that in there and then you usually have to cut it apart and pop out big pieces. You do have to put that in a hazmat jar. We used to have those sitting on the counter. We dispose of our mercury a little differently now, but or the rest of it, don't worry, went down the drain, went down the suction and into our water supply. But you would tell a patient that and say, this was just in your mouth, and now when I take it out, it's going to go into a hazmat jar. They were just blown away that had been put in their mouth to begin with. But that question you ask of why a conventional dentist wouldn't think of that, and it's because they just haven't been educated in dental school. I don't know exactly how they're phrasing it now, but I know when Candace and I were there, and I know when Stuart was there, you're taught that it's safe, and anybody that says it's not safe is crazy. They're wackadoodles, and so. They just haven't ever been exposed to any other types of any of the literature on it, any of the research on it, and it's unfortunate. And these days, I don't think there's any kind of an excuse to not be educated on it. But obviously, there still are some people that buy into that idea that it's still completely safe and completely inert, and that it never could hurt anyone while it's in your mouth. Now, out of your mouth, most people agree it's not okay.
That's crazy. Candace, are you seeing a lot of dentists wake up? What's the state of like conventional dentistry, and Are conventional dentists waking up, do you think, to what you guys are doing and what people are doing in the natural health space with this?
I think so. I'm really encouraged that, a lot of the millennial dentists that are coming out, just with the access to information they have, and then maybe just too personality wise, that they're not afraid to question with all the information that they're empowered with. I'm very hopeful. And I think Dr. Nunnally's mentioned before, the academy that we're members of, the IAOMT, had a pretty small membership. And then it just seems like all the time I'm getting emails or seeing, people on Instagram, look at all these new members we have, look at all these new hygienists. Patients are expecting more. It's just being talked about a little bit more. And then, there've been some environmental pushes too. In Texas, we have these separators now that take that mercury out of the water so it doesn't get back into our soil, into our food. And so people are smart. They're like, okay. And dentists are too. They're like, well, gosh, let me think about this. So I'm very hopeful that more and more dentists are going to feel more comfortable with functional dental principles and just not lean back on that doubt that's created when you're in dental school that, okay, this is only for, like Lane said, people that have crystals that tell them what to do. Sorry, the lights are kind of weird in here. I did that and the lights came on. That was cool. But the lights are on a timer. They went down.
That's yeah, it's funny. I just searched Google most toxic metals, and the first one that came up was mercury. But somehow I guess you get taught in dental school that it's okay as long as, it's in the mouth or whatever. But it's just interesting. That's the first results in Google is mercury.
Well, every now and then it actually does beat out plutonium. Usually plutonium wins, but they're running neck and neck.
Yeah, it's funny. I see mercury, lead, chromium, barium, gadolinium, thallium, bismuth, zinc. What was the one you said, Dr. Nunnally?
Plutonium. Every now and then Google misses something.
Oh, yeah, for sure. That's wild.
I had a question is that okay back to the pediatric real quick question?
Sure.
There was a member of our private academy who lives about 20 minutes south, and they're going to be moving, I think, next month to Texas. So they were asking about their children. She has twins as well, I think, that are at least 6, maybe. But she was saying, does Dr. Nunnally's office treat pediatric? And I said, gosh, I should know that, and I don't know that. But do you?
I know, we get asked that a lot.
See you later.
I hesitated. This is a good thing to talk about, though, because we get asked all the time. So we've all had experience with treating kids in the past. But, kids are not just tiny adults. There are a lot of intricacies in terms of, we want to make sure they have a really good dental experience. And pediatric dentists are awesome at that. They have everything in their office set up to not cause a child to feel scared about what's going to happen, have them love dentistry. And they also use sedative agents. We do sedation, but it's different to sedate kids than moms and dads and grandparents. And so Dr. Freeman and I were the ones primarily that were doing some sedation of children when I first came into the practice. But then we realized that you really need to be an expert in sedating children if you're going to do that consistently.
Yeah.
And we've focused our energy into making sure that we are on top of everything safety related to sedating adults and materials and all these things we're talking about. It just became difficult for us to be practicing at the level we needed to be for these kiddos and keeping up with all the advances in pediatrics.
Yeah.
But it's something that there's such a great opportunity when we were talking about, hey, are other dentists learning about functional and biological dentistry? I would love to see a crop of pediatric dentists that are willing to take their profession to that level in terms of looking at not just some of the conventional things, but some of the things that moms and dads are wanting for their kids.
Is there a place people can find that? I know like acam.org and places like that exist to find. How does somebody even find a decent pediatric dentist that could be trusted?
I would definitely, word of mouth. Candace, I didn't mean to interrupt you.
Good.
We have patients ask all the time for their kids, and as of right now, we don't have a real great place for them to go, like a website or a search for dentists in their area. But there are some great pediatric dentists, even if they don't classify themselves as a biological dentist or anything like that. Like, for example, we have a practice that's fairly new here in Marble Falls, and it is a pediatric office. They would consider themselves, I think, conventional, but they do not use mercury. They do not use nickel crowns. They are very open to when we send patients to them on, not forcing the fluoride issue. And so there are some more offices. Once again, I think a lot of it is patient driven, but also I do think some of them are, like Candace said, they're waking up. These are this younger generation of dentists, and now some specialists that are seeing, even if they don't want to classify themselves as such, they are wanting to look at how what they put in the mouth can affect kids, which is huge. And so I say word of mouth, asking for recommendations. I'm not sure where your friends are going to be.
I think we just went away. I think we just got kicked off.
I didn't push any buttons, I promise.
I didn't either.
The powers that be don't like this conversation.
No, that's great. That's great. It's funny because now that we have 2.5-year-old kids, we have a lot of questions about pediatric dentistry, and so I'm wondering, we brush our kids' teeth every night, and we do the best we can with what they'll let us do. Are there any tricks that people should try to do to try to make sure they get their kids' teeth brushed properly at night when they go to bed?
Good question.
Yeah,
that is a good one. It really
Candace has the littlest ones right now. So
I have a 6-year-old and a 9-year-old, and so it's funny. A dentist pre-kids, people would come in and bring their kids in, and their teeth wouldn't be that clean, or they'd have cavities, and I'm like, oh my goodness, what is the deal with these people? Come on.
Yeah.
Lane and Stuart can relate. You're like, come on, just brush their teeth, or have them eat kale. What's the big deal? And it's harder than that. I mean, it depends on the child. I think we've tried all kinds of things. Like, I have one that loves to sing, so you can play a song. It seems like the longer, when it's age appropriate, they're in there working on it, they're most likely gonna get all the surfaces. And then I've assisted them in brushing. I still do some. I mean, there's no shame in that. Sometimes you just have to help them get all the places. Mm-hmm. And if you make it fun, if there's a character that they like, or, we don't like the toothpaste that typically have the cartoon characters on them. Those also have typically junk in them, but there's other ways to make it fun, with the paste and the activity. And a lot of times you just have to help them.
Yeah.
Or if they're grandchildren, you can give them a piece of chocolate after you brush them.
To bribe them.
That's hilarious.
I was curious too. I know Dr. Owens, you mentioned earlier about the sealants. I heard you say that word. Is that frowned upon? I mean, I remember having them done as a little kid. What's in that stuff? And is that a bad idea for kids?
No, that's a good question too. That would be something that some of the older kids that we are able to see in the practice, moms will ask, should their teeth be sealed? We look at each patient very individually. We look at the grooves of their teeth. We look at their diet, their propensity to have cavities. So we very rarely recommend things across the board. And I know you guys know that. We try to look at each person individually. There are some sealant materials that are really quick to use that can draw fluoride to the material, or that have BPA in them. And so we use something a little different that is light cured. And we usually try to incorporate ozone, underneath, like we do in almost all of our treatments, to make sure that the tooth is really clean, and then bond it in. And it just takes an evaluation from your dentist or your pediatric dentist to see if it's necessary for that child and that tooth.
Is there an issue with a child getting a cavity, in their first set of teeth, and then, obviously those teeth will fall out and they get new teeth? Is that really, is a cavity in a tooth in a child a real big deal, or does that set the stage for the tooth that replaces it to be less healthy as well?
Well, we call those our practice teeth. I tell, we do have, if we have a family that's established in our practice and maybe their child has come in for a cleaning. If they have some cavities, we tell them these are their practice teeth. This is the chance that you have. We can fix this, but it definitely doesn't correlate with that you're going to have cavities in your permanent teeth, but it does kind of get their attention. My kids definitely had cavities when they were little, and so I have walked through that. So, a lot of times you do need to fix those cavities so that they don't cause a bigger problem, like Candace was referring to, with teeth needing to be removed and things. And so you definitely want to fix those. But so I just saw somebody the other day, and the child is probably a month from losing a tooth that the cavity's on. And there would be zero reason to fix a tooth that they're about to lose anyway. So you kind of have to look at it in each individual case. And I think even a pediatric dentist would say the same thing on that. It's easier to fix it when it's small. A small cavity is much easier to fix than a large one. But you kind of weigh that, knowing that these are teeth, they are going to go away. So you get to start over.
I wish we got a practice body, but that's not.
Oh,
I like that.
Totally.
Just take a mulligan.
It's so interesting, all this stuff, because it seems like there's so many people these days with kids that have such unhealthy teeth and so many cavities. Like I have a friend whose teeth is just crumbling, and I don't know, like there's got to be a connection to diet, following more of a Western A price type of diet where you're getting more of those traditional nutrients and, not eating all this processed food. I mean, it seems like kids these days, their teeth, every time they go to the dentist, they've got 3 or 4 new cavities,
That's, I think is exactly what you just said, Justin. It's, most of it is a function of diet. Mm-hmm. And then sometimes, sometimes kids just don't get their teeth clean, for Pete's sake. A lot of it's not rocket science. It's a matter, if you don't clean the rest of your body, it's not going to do well either. So you eat a bunch of junk and you leave it in there and it's going to ferment. And before you know it, you've got a hole in the tooth. Mm-hmm. And so, what you said about Weston Price is exactly the truth. And he proved it over 100 years ago. And that is, if you stick pretty much to your ancestral diet, in many ways, the tooth will become self-cleansing. Mm-hmm. And in many of those indigenous communities, they never brushed their teeth, but they ate what their ancestors ate, and they were robustly healthy, including their oral health being outstanding. So I think he hit it right on the head. If we stick to our ancestral diet and avoid the traditional American diet, we'd do much better.
Yeah, it's interesting too, because you look at indigenous people like the Aboriginal culture or just indigenous cultures around the world, and I don't know what their oral health is like overall, but it seems like you see them and their mouths or their jaws really wide, and they have a lot, some space in between their teeth, and you don't really see that too many, these days, do you?
No, you don't, but occasionally we do. Occasionally we see a family that has really for generations. And sometimes we see it among some farming communities. And we have maybe a number of patients from those communities, and consistently those children have these beautiful full arches and straight teeth, no need for orthodontics, robustly healthy skeletons and musculature. And those are usually from families where they get plenty of sunshine, fresh air and clean water and good wholesome food.
Mm-hmm. Hey, Dr. Owens, can you talk a little bit about root canals and the dangers of root canals? Because it doesn't seem like a lot of people, I hear people all the time getting, root canals, or there's people that talk about them like they're no big deal. But these things, I mean, aren't you leaving essentially a dead organ in your body when you get a root canal?
Yes. So similar to what Dr. Freeman was saying, whenever we were in dental school and trained on root canals, I really don't remember any education on systemic correlation to the root canal. We did talk a little bit about that when you were talking about an abscess, that if somebody left an infected tooth unattended to, eventually that was going to make them sick enough that X, Y, and Z was going to cascade. But everything in terms of education of root canals where I attended, which was an excellent school, technique wise, was just that technique, how you're going to do the procedure. And so I know your listenership is very educated, but if you have that infected tooth and then you go to the dentist and they numb it up and they take the nerve out of the tooth, then you're losing the majority of your awareness of how that tooth is doing in your body. You can still sometimes have sensation from extra nerves, but for the most part, you're severing that. You're taking it away from the body's ability to take toxins when bacteria could get incorporated in during this procedure. So we'll back up a bit. You take the nerve out. The dentist or the endodontist does their very best job to try to cleanse the tooth and then put some filling material back into it so that you can keep that, exactly like you said, non-vital mummified tooth in place to function on. But there's miles of tubules in there. Bacteria get in. We know that not all bacteria need oxygen. They can make toxins. Then those toxins can set up shop in the tooth, and we find greater volume of that in the bone surrounding a root canal treated tooth. And then there are many white paper studies and studies Dr. Nunnally has even put together to show what type of impact. Well, the study that Dr. Nunnally participated in, or that we did out of the office, was related to looking at a root canal on an X-ray. That's typically the metric dentists use to say if a root canal is successful or not. Patient symptoms, which you can't really feel anything because the nerve's been taken out, and how it looks on the X-ray. 2-dimensional X-ray for his study. So those are the two things we're looking at to try to decide if this is something healthy to remain in the patient's body. But it's way more complex than that, we're finding. Now we're using 3D cone beam technology to look more critically at those. And we're seeing so much more than we could see in the past with 2 dimensions.
Wow.
Then getting back to some of those other papers, we're also seeing that enzymes are inhibited associated with those toxins from the teeth. And there are many researchers and healthcare providers drawing attention to the impact that could have on the body. So I know Dr. Nunnally and Dr. Freeman probably have more to say. I'll let them jump in.
Yeah.
Oh, that was a good summary, Candace.
Yeah, it's fascinating. So, I mean, like a lot of these downstream processes that happen in the body, it's amazing that, toxins in something like a root canal just festering in there, is pretty fascinating, because if you think about those enzymes not working, then you have a series of things that have to compensate for that, right? And then it's like if your liver has over 500 functions, and if it can't do certain things, then your body has to compensate, or you start to get symptoms of some weird thing. So it's amazing. I mean, I bet we probably won't even know in our lifetime, that all those downstream processes that aren't working as a result of those enzymes not firing off correctly,
Yeah. And, I talk back to the logic thing that we talked about with mercury fillings. The logic that doesn't add up with a root canal treated tooth is that this is the only thing, this is the only place in the body that the medical community has said it's okay to have dead tissue. We recognize that anywhere else in the body, if you have an appendix that dies, that needs to come out. If you happen to get, frostbite on your toe and turns into gangrene, we know that when that tissue dies, you have to cut it out. Dead tissue is not compatible with life and with health. And so when you kind of say it like that, you recognize that even though it's a great idea, it would be lovely to save all the teeth, but they are living when they are healthy. And once they're dead, that dead tissue is there, whether it's hurting, as you know, Candace was saying, or whether it's just completely asymptomatic. We have so many patients that say, okay, it doesn't hurt, but I'm just aware of it. Like, it doesn't feel like my other teeth. Well, that's because it's not like your other teeth at this point.
Yeah. Wow.
Yeah, I'll rapid fire just a couple quick questions from listeners because I know we want to be aware of your time. I'll just maybe ask 3 more, but someone asked about what is an alternative. Is there an alternative to a root canal? I'm guessing it's probably the extraction of the tooth.
Uh-oh.
Yeah, I mean, once it's been established that a tooth is actually dead and or on its way to dying and is infected, really I wish we had life support for or CPR for teeth. It'd be great if we could bring them back to life. But once they're gone, they're gone. And so then that becomes, if you want to remove that source of chronic infection, removing the tooth is what's necessary. Now, I will say, though, that we have patients that call and say that a root canal has been recommended simply because a filling is really deep or there's something going on. And that's not always the case. It's an easy fallback for some dentists to go ahead and recommend a root canal if they're just anticipating that one might be needed. And that's a lot of times we're able to save teeth that might not necessarily need a root canal. But once the tooth is already dead, or we can tell it's irreversibly damaged, then that does become the next option.
Oh, good to know. This is an interesting question. Someone wrote, if you used to wear a retainer and stopped several years ago, should you wear it again?
Oh.
Can teeth shift so much so? Even as an adult, is that something you want to get looked at before you throw an old retainer in your mouth?
Well, and most likely, if it's been out for several years, it's not likely to fit. The teeth will shift enough that they won't fit. So better go for another one. I'd recommend going for one that's has no metal in it and is made from a biocompatible material.
That goes along with the next question. What's another alternative to kids' metal braces?
Ooh, good question.
Yeah, we have an orthodontist in town that there's clear aligner systems now. You may have seen things like Invisalign. And most of those are BPA free because that's typically the next question is what's in those. Right. And then we work with an orthodontist too that can use some nickel free metal components if that's really the only option for the type of tooth movement that child needs. So once again, just opening up that conversation and asking them, hey, what are our options here?
Good to know. And then maybe the last one will ask you, I'm not sure what this is, but they said, what's the best natural treatment for enamel dysplasia? Am I saying that right?
All right, guys, just a quick break with more Dr. Nunnally talking about the Relax Far Infrared Sauna and sauna therapy in general.
What I chose to do? I chose to go very, very slow as I detox. So one of the things that I did is I invested in an infrared sauna, which was huge. That was a big, big part of my healing because, interestingly enough, many times patients who have heavy metal toxicity lose the ability to sweat. And so I was one of those. I could not break a sweat. And the infrared sauna helped me to retrain my body to be able to sweat. It was a huge part of my overall detox.
Doesn't Dr. Huggins say as long as there's more going out than what's coming in, you're okay?
Absolutely. Yeah, and I think he's right. I think he's absolutely right on that.
Here's our buddy Daniel Vitalis talking about sauna therapy as well.
I won't go on about that, but I think it's important to use saunas because they help to increase body temperature. There's a lot of great benefits to that, but some that I like are that in wild nature we experience hot and cold, and at room temperature, which is a domesticated thing, we don't really get to feel metabolic extremes. So I think it's really good to challenge your body to cool itself and to heat itself, and so because I'm saying heat itself, I really recommend cold showers. Let's say 80% of your showers and cold. Right? You don't have to do it every time, but most of the time, if you end your shower cold, you'll start to build up your resistance to cold, and you'll also really tonify your skin and also kind of help to wring your body out at a detox level, that's really important.
It's my belief that every home should have a sauna in it, and we sell all kinds of different saunas on our Biocharge Me store. If you guys are interested in the wooden ones, we sell the clear light saunas, we sell the Thera Sage sauna, we sell the Relax Far Infrared sauna, which is the one I use and I recommend. We sell the ozone saunas. We sell all kinds of really amazing saunas in our store, biochargeme.com. So make sure to check those out. And also, here's a little device that I want to tell you about too, red light therapy, or LLLT therapy. Check this out.
Deeper. Okay. Red light can penetrate up to 30 centimeters.
Oh, wow.
So it doesn't penetrate as deeply into bone, but if you have, fat or muscle, it penetrates pretty deeply into there. So blue light, it doesn't penetrate as deeply, but it's the highest energy frequency of light in the visible spectrum. And, blue light is in the sun too. So blue light is not a bad thing in nature, because when you get blue light from the sun, it's balanced with these other colors of light. And red light is very regenerative. And that's why I'm sure you've had people on your show, Justin, that talk about photobiomodulation, or low-level light therapy, using specific frequencies of red light to regenerate your skin or to speed up muscle recovery. It's very big in professional sports. It's big. A lot of vets are using it now, too. I think I hear about more vets using it on animals than doctors using it on humans. But beauticians use it. It's really good for your skin. Some places women go to for, get a haircut, they'll put them in front of like a red light thing in their face because it's good for their skin too.
Yeah, so red light therapy is incredible for not just building ATP production and making more energy and complex 5 of the mitochondria, but it also helps you to hold on to more light, and it increases the electron chain transport in the mitochondrial membrane, and it allows the mitochondria to make more of that fourth phase water. And it's really great for collagen production. It's great for muscle recovery, for any kind of skin issues. I like to use it for preloading my body with the right frequencies of light before I go into the actual sun to minimize burns and stuff like that. It's really great for wound healing, for anti-aging, for joint inflammation. It's really great for infertility. It's amazing technology. It's really an anti-aging technology. So if you guys are interested in the red light therapy products that we recommend, check out our store, biochargeme.com, and I'll put a link to the specific Juve device that we use at extremehealthradio.com/693.
A healthy diet. They're thinking of maybe a dysplastic, something that has dysplasia is basically malformed, or it has the integrity of it's been insulted. And so how would you do that? For example, how would you remineralize a tooth? Mm-hmm. Well, a healthy diet can do it, especially if for example, if decay is just reached barely into a tooth, you can remineralize the tooth. For the most part, if it's reached through the enamel of the tooth into the dentin, they may be able to be remineralized, but for the most part, those are going to require some kind of restorative dentistry, usually a small bonded filling. So I wish we could completely rehabilitate teeth without having to use any of our bonding materials. But to date, we don't have really great predictable materials that will rehab teeth.
Come on, Doc. I keep hearing all the time we're supposed to be able to regrow teeth from stem cells. I see all these articles.
You can tell I'm blushing because I thought by now we would have been doing that for at least 10 years.
I know. Get with the program, right?
And it's pitiful. We're still not there. We're still not there. But hopefully it won't be too much longer, Justin.
That would be awesome, right? Can you imagine regrowing a tooth from stem cells? They claim they've done that. That'd be amazing.
Oh, we want to do that. We want it in. Actually, it is possible. The problem is, there are a number of problems still. But I think at some point, and then surely within the next 5 to 10 years, that will be available.
That would be awesome. That'd be amazing.
That goes along with the very last one. Someone asked, what type of dental implant would you recommend then, if any, until the stem cell thing becomes an option?
Well, that's every patient needs to be considered individually, because sometimes patients, any kind of an implant's not going to be appropriate for them, either because of the structure of their bone or because their immune system really can't handle anything foreign being implanted, regardless of whether it's a biocompatible type material. But if you're going to have an implant, we would definitely recommend a zirconia or an all ceramic implant over a titanium implant. And, you know, the market is really catching up with what people are asking for. And there are many, many types of, or many brands of zirconia implants now. And the research looks really, really good on those. We are restoring a lot of those now that are being placed by specialists. And so that field is really opening up. So if someone was going to have an implant and it was deemed that they were healthy enough to do so, then a zirconia would be what we would recommend over titanium. So
great.
That's so interesting. So your clinic is just, it's an amazing place because it doesn't feel like a conventional dentist office to me at all. And I know so many people have issues, like they don't want to go to the dentist because they're afraid of the dentist and all this stuff. But your practice is so cool. And last time we were there, Dr. Nunnally, you were showing me around and you have expanded. You have a whole separate sort of side of your building now. You're doing all this. I don't even know what you're doing over there, but it's pretty incredible. Talk a little bit about your practice. I love it.
Well, we have, you know, in our practice, we have 4 partners where we have such a fabulous time together. It's stimulating to be in that practice because we're always bringing new ideas to the table, and we have a fabulous staff who's open to change, which you must be if you're going to be cutting the edge. You better be, you know, you just better have a great staff who can not only stay with you, but motivate you as well. Mm-hmm. And so we have that. I think we have a world-class staff. We're so proud of them. And then we have, you know, Justin, there are a couple of things I think that probably set us aside. One is that we don't want in any way to be embarrassed or hide from our faith. We want people to know right up front, you know, we're a Christian organization, and we love people of all faiths, and we see people of all faiths literally every day. We're so grateful for whomever the Lord trusts to us. But that's a big part of what we are and do is that, you know, we want to be Christ's representative here on this earth. And so it's like the mainstay, the hallmark of our practice. Mm-hmm. And so when we're dependent upon Him and His discernment and His leadership and His zeal for His people, it just makes practicing fun. Mm-hmm. And so I think that's probably what sets us apart most. You can tell. And you already know how fabulous Lane and Candace are. And if Rich Dorsey were here, you would see the same in him. Just sweet people.
Yeah.
Trying to do our best, you know.
I just remember when I think you did my procedure last time, it was, you know, we prayed before the, you know, procedure. And I mean, I've never had a doctor of any kind do anything remotely similar to that at all, you know, and that was just so comforting. And, I feel like if anyone is scared of the dentist and doesn't want to go to a dentist because they've got some sort of psychological trigger or something like that, I mean, your practice, we work with Dr. Bergman, who's a chiropractor out here in California, and people fly all over the world to see him. And it's the same with your practice. Like you're the Dr. Bergman of dentistry, all of you guys, your whole practice. And it was just so comforting when we prayed before my procedure. It's just, I don't know. There's something, I'll never forget that. It was amazing.
Great.
Oh. Hey guys, I'm going to sneak off. We're going to go catch a flight out of Austin. So I am going to sneak off, and I can hear my husband knocking on the door lightly behind me to remind me it's time to go. But I so enjoyed getting to visit with you all today.
Likewise.
Very fun. Always great to see you. Hope y'all get back to Texas soon.
We will. Thank you so much for your time.
Have a great flight. Have a great flight.
All right. Talk to you later. Bye-bye.
Okay.
Bye. Yeah, we should let you busy people go too.
Yeah. So what are you guys going to do? Dr. Owens, what are you going to do the rest of today? Anything fun?
Yeah. I mean, Friday, fun day.
Right?
So I have we usually like to be outside in the sun. We're definitely lake, pool kind of people. It's not quite that time, but I have a 6-year-old's birthday party to go to.
Oh, cool.
And then after that, I have a date night. So I'm really excited about that. Yeah, we don't get that very often. We're going with our neighbors in the cul-de-sac, and they have a special needs child and another a little toddler. So this is like big night for us.
Wow.
Yeah.
So you have 2 kiddos, and you're going to get them.
I do.
And oh man.
So birthday party, and then these lights. I'm so sorry. It's like you see it goes. I move my hands, and they go. They're on a timer. It's like
that's okay.
Yeah, my head's disappearing half the time. So with the green screen, so I'll
get better.
That's awesome. That sounds like a fun night. And what about you, Dr. Nunnally? What are you going to do? Anything?
Oh, Rebecca and I are headed straight to the garden. We have we had this unbelievable freeze, and one of the most blessed things that happened is it wiped out most of the grasshoppers.
Oh, there you go.
And we're so tickled. So our tomato plants have never looked better. And so we're going out to spend the day in the garden and then picnic out there tonight. It'll be beautiful.
Oh, that's so cool.
We can say we can picture it.
And how is Wendy's house coming along? Is there construction and things happening on her property?
Wendy's house is coming along very well. And by the way, I was to tell you all about her 3-year-old granddaughter.
Oh, okay.
Who's just the most beautiful thing.
Mm-hmm. Oh, wow.
Mm-hmm.
Yeah.
That's so
How about
great.
you all? What are y'all going to go do now?
What are we going to do, Kate?
We're going to chase some kids around for a while, and then we're going to chase kids around again, and then we're going to chase them around for a few more hours, do dinner, and then put them to bed.
And then put them to bed and collapse on the floor.
No, then you're going to look in the want ads for real estate in Central Texas.
Oh, that'd be awesome.
You don't know. I actually go on Zillow once a week and see what's out there. I just can't stop looking. So I think it's a matter of time.
Oh, man.
We love you guys. We love the spirit there. We love the hand of God on this area. We feel very at home when we're there, and we just feel like you guys are family. So thank you for making us part of yours. We really appreciate it.
You guys are so cool.
I love you guys.
Thank you.
All right, guys. Have fun on your date night. Dr. Owens, Dr. Nunnally.
Oh, thanks.
In the garden, yeah.
Tell Rebecca we love her and send our love to your family.
Thank you.
Yeah.
If you'll come in about another 40 days, you're going to have beautiful batch of tomatoes to come pick. So don't stay away too long.
We won't. We'll be there.
I love that.
Make some salsa.
All right, guys. Have a fun rest of your day. I love you guys so much. Thank you.
Bye.
And thank y'all for letting us. Thank you for letting us be a part of this.
Oh my gosh, absolutely. Very grateful. Yeah. Thank you.
Most definitely. All right, guys. Love you guys.
Bye-bye. Love you.
Bye.
Thank you.
Bye. All right, guys. I hope you enjoyed that episode. We're doing a little bit differently these days. Just to let you know, we're considering moving away from YouTube. Check this out. So we did a video for our Extreme Health Academy. This is so crazy. The amount of censorship that's happening. So we did this video, right? And it was a video that we did for our Extreme Health Academy, and we did not a milder, but a lesser information dense video for YouTube. And it was all about making homemade baby formula. And YouTube took it down. And they said, we're going to be nice. We're not going to put a strike on your channel, blah, blah, blah. But we've removed your video because it doesn't follow our community guideline standards. I mean, the censorship is insane these days. And so I think what we're going to be doing, we have accounts on like Library. We have accounts on, I think, Brighteon as well, and as well as BitChute and stuff like that. And so we're going to start just moving away from these platforms. And, I would recommend that you guys do that too. The main issue with, these other platforms is that a lot of people like us, the truther people that are really putting information out there that's actually helping people, we're all moving over there, right? But the problem is that, it's never going to become the sort of main place where people go to, look at information, because people that are making cooking videos and funny dog and cat videos, they're not putting their stuff over there on Brighteon or BitChute, because they're not getting banned or deplatformed, because they're putting out such I don't know, such, innocent content that it's never going to get touched by YouTube. And so the majority of the people are going to still go to YouTube for that kind of content, which is unfortunate. But, the only way to sort of disable and disarm these big tech giants is to just move away from the platforms. And so it's unfortunately, I think we have 70, 80,000 people subscribed to us on YouTube, and we've been heavily banned and shadow banned and stuff. So not many people see those videos anymore because we've gotten so many strikes and all that kind of stuff. So anyway, just a little update as to how that works. So we're going to be slowly moving away to BitChute and other platforms. I think there's Float. There's a bunch of them that we're subscribed to. So make sure to subscribe over there. And that way you can follow us. And we're just going to be moving away because, they don't want us. We don't want to be in a place where we're not wanted. So we're going to be moving slowly but surely over there. And I would suggest as well for you guys to slowly start moving your attention to other platforms, because that's the only way that we disarm this big tech, is that we just stop using them. We just stop participating, and stop sharing stuff like that. So anyway, I hope you guys enjoyed that show. That was extremehealthradio.com/693. So I'll put a link to the Relax Far Infrared Sauna, the Bellicon Rebounder, and the AquaCure, which were today's show sponsors on that show, as well as links over to Healthy Smiles for Life. I would really recommend going to see Dr. Lane Freeman, Dr. Candace Owens, and Dr. Stuart Nunnally. It was really cool for me to get to know Dr. Owens a little bit more because, like I mentioned on the show, in 2010, I had Dr. Freeman remove my mercury fillings. And then since then, I've been working with Dr. Nunnally, but I've never really had any work done by Dr. Owens herself, but she's so cool. There's so many great people over there. And like I mentioned at the beginning, if you're currently struggling with digestive issues, if you're struggling with your health, I would really recommend getting your oral health fixed. So if you have a root canal, if you have a cavitation, if you have some cavities, if you have mercury fillings, these types of things, really consider getting some work done, because my contention is that a huge percentage of the immune system is just basically bogged down with dealing with these infections that are living in our jaws, that are living in our health, in the bone underneath these teeth. And so he did a little test on some of my bacteria and pathogens that were in my jaw when he did my cavitation work, and it was just like, oh my gosh, I can't even. It was like ancient diseases and protozoa, and just, oh my gosh, so much crazy organisms living in my jaw. I had around 2000, I had 4 wisdom teeth removed. This was before I woke up to any of this stuff. I didn't wake up until 2003, and then my journey just skyrocketed, and I've just been charging ever since. But in 2000, my dentist said, hey, you have your 4 wisdom teeth. They're kind of halfway in. Are they causing any issues? And I said, no. And he said, are they causing any pain? I said, no, not really at all. I feel fine. He said, even though it's not causing any issues or pain, you should still get them removed. So like a stupid idiot, I just listened to him, and I went to a surgeon, and they took out my 4 wisdom teeth. And fortunately, I never had any issues with them. I didn't feel anything. But basically what a cavitation is when you remove a tooth, and then the gum tissue grows over the infected area where those teeth were. And typically, conventional dentists, they won't remove the periodontal ligaments. So you have all kinds of ligaments that continue on, and basically they just die. And then when that pocket of gum tissue grows over that, you have this area of anaerobic sort of bubble that's being depleted, and it's growing and it's festering with toxins of all kinds. And because it grows over, your saliva and your natural immunity and your immune cells and your white blood cells can't get in there and get on top of that. So it just becomes this toxic, festering environment, and it starts eating away at the bone, and it puts a tremendous burden on your immune system. And so that's why, like, a lot of people see tremendous results from just fixing their oral health and making sure that you get these things cleared up. So I had 4 wisdom teeth removed, and all 4 were cavitations and filled with all kinds of crazy things. And then I had a couple root canals that was taken out. And I had, in 2010, I think 4 mercury fillings from cavities from, years before that. So, for me, getting my oral health fixed was the biggest thing that you could ever do, because you can't really put a price on that. if you consider the toxic environment that we're living in, which is non-native EMF, blue light, dirty electricity is in the walls, Wi-Fi's, WLAN, all this sort of toxic frequencies that we're living under, not counting the chemicals in our, environment and our beds, off-gassing and the carpets and things. You combine the Wi-Fi with those types of chemicals and then the blue light, and then you put together that with toxic food and chemicals in the food, along with the stresses of modern day life, it becomes a situation where, that all of those things, including your teeth. I mean, your teeth alone could be, this is just a guess, but your teeth alone could be putting a 30% burden on your immune system. Maybe 30% of your immune system's just consumed with getting on top of these organisms that are growing in your mouth, or the mercury fillings in there, right? So then you have like another 60% of your immune system being taken up with modern day stresses and toxic chemicals, right? So then you're looking at like a 90% of your immune system is being taken up by these, modern day stresses. So that means you have like 10% of your immunity left. And then, changing your diet is really not going to affect that much, right? So I like to focus on the areas of your health that move the needle the most, So, you can take some herbs, you can take some supplements, you can take some digestive enzymes and stuff like that. But man, focus on those things that are putting the burden on your immune system the most. Alter your environment. Fix those areas of your home, of your workspace that are putting a stress on your immune system. Fix your oral health. Get this stuff fixed, because if you do, it's going to be, it's going to help your health so much, right? Because this is something I recommend a lot. A lot of people, when they get into health, they immediately start with nutrition. And, it's good to clean up your diet. And there's nothing wrong with cleaning up your diet, but I don't start there. I always start, with your environment first, and removing the things from your environment or past issues like, mercury fillings, maybe. Fix these things first. It's not going to do it any good, in my mind, to remove, switch to organic grass-fed beef if, you're sitting next to a Wi-Fi tower, if there's a cell tower, a 5G tower that just got installed a block away from your house, or if you are, living under toxic blue light, or if you got this dirty electricity in your walls, if you just painted your home and you have toxic fumes coming from the lead and the chemicals in your paint and the heavy metals there, So, fix those areas first, because, those things are going to make a bigger difference in your health than changing your diet. The reason why I say that is because not that I devalue changing your diet, but it's just when you're dealing with something that's related to discipline, it's so hard, right? Because it's really difficult to change a lifetime of eating. You're fighting with yourself, trying to make sure that you don't eat that late night dessert or that soft drink or whatever you want to drink, and you're just fighting with yourself and you're beating yourself up for making the wrong food choices. It's just difficult, right? So, like the saying always goes, right? If a fish is sick, do you change its diet or do you change the water it's swimming in? And so we are products of our environment. If our environment is toxic, then we're going to be producing toxic results. So I always recommend changing and altering your environment, always, because it's the easiest thing. It's passive, right? Like the Magnetico sleep pad, for example. You're going to be sleeping for 8 hours a night anyway. Why not sleep in a protective magnetic field that's going to be helping your lymphatic system and your brain and nervous system detoxify heavy metals while you sleep? Why not do that, right? You're going to be sleeping in a bed anyway. Why not protect yourself when you're sleeping in that magnetic field from Wi-Fi and dirty electricity, and wireless radiation, because that's what sleeping on a Magnetico does. So it's like, it doesn't take any extra effort to get into a bed that has a Magnetico than it does getting in a regular bed, right? You're going to be sleeping for 8 hours a night. Why not improve that? And changing your light bulbs in your house. It's like, these things don't really take a lot of effort. They're one-time purchases maybe, but they're totally passive. And so this is why I like promoting your environment first, and if you are really into, your health and you want to, start taking some supplements and, working on your diet and nutrition, that's great too. I really recommend that. But the problem is that people start there, then they can't stick to it, and then they beat themselves up, and it becomes this perpetuating cycle of self-deprecation and beating yourself up and all this type of stuff, when you'd be much better served if you had to pick one of the two to alter your environment first. Get the ball rolling. Live and work in an environment that supports your health, and then you'll notice a difference too. Definitely notice a difference. So if you guys are interested, make sure to check out the links for this show page, which is extremehealthradio.com/693, and go to healthysmilesforlife.com. And what I always recommend, for Dr. Nunnally's office, they're in Texas and we're in Southern California, and we've flown there. We've driven there twice with our kids, from California to Texas. Usually it's like a 3-day road trip. We'll just pack everybody up and we'll rent a minivan and just, take 3 days to get there. And, and it's worth it. Our family and friends think we're crazy. Like, why would you drive halfway across the country to go to a dentist? But until you realize, how important this is, then it does seem like it's crazy. But once you understand the connection between your teeth and your overall health, then you realize, like, wow, this is a big deal. So people fly from all over the world to see Dr. Nunnally, Dr. Freeman and Owens. So I would recommend, go there. This is what we do. Put it on a credit card and just pay it off over time. That's what we do. It's just so important to do, and I can't recommend them enough. They're just such great people, and I hope you enjoyed today's show. That was awesome. Really, really appreciate it so much. And let us know if there's ever anything we can do for you, if there's anything that we can help you out. If you want to work with me directly, I would join the Academy. There's a 14-day free trial if you want to join, and that is at EHR14. That's the code. That's a free 14-day trial at extremehealthacademy.com, and there's a form there. I'm in there every single day. Every Friday morning, I'm doing Zoom rooms, and we're all hanging out as a group and sharing ideas, sharing inspiration, sharing different things that we've learned, the different protocols, and we're all helping each other as a group every Friday morning. Twice a month, my wife Kate does the Women's Wellness Hour, so she hangs out with all the amazing, beautiful women in our academy on Wednesday mornings at 10 a.m. Pacific. Every other Wednesday. Once a month, Dr. Bergman's doing a live, so that's on the third Sunday of every month. So every week we have live events going on. It's really cool. And then also I put together, what I really think is cool is I put together the self-care guide. And the self-care guide is a month by month sort of list of things that we're going to be going through as a group to take care of our health. So coming up in April, we're going to be working on liver health. This is March. So in March was a blood donation. And so four times a year I donate blood, and that's in the self-care guide. And every month there's something that we're going to be working on together as a group. And so we're going to be working on some liver supportive practices and protocols. I'm not really a big fan of heavy, deep cleansing and drinking, 8 ounces of olive oil and doing all that kind of stuff. I feel like that's a real stress on the body. But we're going to be working in a supportive way to help upregulate our different organs. So we're going to be doing a colon cleanse. We're going to be doing a heavy metal cleanse, a parasite cleanse. All these different things we're going to be working on as a group, and you can join. And they happen every single month. So come and join us inside the Extreme Health Academy if you want to meet other crazy, weird people like us, and that would be really, really cool. So it's a great place. There's thousands of members in there from all over the world, and we're in the forums every day. And there's also courses and workshops that we do. We do live workshops every month, courses every single month as well. All kinds of cool stuff, man. It's amazing. So if you want to meet, other people, if you're like, man, none of my friends are really interested in health. None of my friends understand the things I understand. None of my friends understand this whole thing going on with Convid 1984, as my friend Matt Blackburn calls it. I love that, Convid 1984. If you guys don't listen to Matt Blackburn's podcast, make sure you do that. He's at Mito Life on Instagram, and he's really, really cool. He's been on the show a couple times. I love the work that he's doing. But, if you're feeling like people in your life just don't get you, or if you're feeling like, man, I'm just talking to a brick wall when I try to talk about the V word to these people, and I'm trying to convince them and share with them, join the club and come over and join the academy, because you will get so much support from people. And it's such a great environment because you're not crazy. you're not crazy. I just want to let you know that, like, you're not crazy. You know, your friends and family and the media and giant big tech and all these other people who control the narrative out there right now, they want to make you think you're crazy. But you are not crazy. You know, there's groups of thousands and hundreds of thousands of people around the world who think like we do. And there's thousands of them inside the Extreme Health Academy. And it's a really great place for us to come over and share with each other and support each other in this way. It's an amazing place. So, come on over and join. EHR 14 will get you a free 14-day trial, and you can come over, check it out. And also, we're putting everything in podcast form, so all the videos and everything like that is going to be available in audio format too. So there's a private access to a private podcast that is the content of Extreme Health Academy. So make sure to join over there with the code EHR14. Just a little plug for some of our upcoming shows. I think next week we have Dr. Cass Ingram. Let's see. Yeah, next Friday we're going to have Dr. Cass Ingram. He said, worry about the V word safety, the CDC's VAERS, Vaccine Adverse Event Reporting System, gives us informed choice. So that would be cool. Dr. Michelle Lamasha Schrader, we're going to talk about recall healing. And then we're going to have Jason Prawl from the Human Longevity Project talking about ancient methods of healing. And we're going to do a show with Jim Stevenson on vitamin D and why you should not take vitamin D. Nicholas Pinot on... and Brian Hoyer. Cool. And we're going to be doing a show on EMF. Morley Robbins. I know Matt Blackburn's coming up on the show. So lots of cool stuff. Make sure to subscribe. So if you go to our site, just go to extremehealthradio.com and click on the subscribe button right at the top of the page there. There's a place for you to subscribe. So subscribe to our newsletter. I give you a little bonus that I can't talk about publicly, but it's a cool little bonus right when you subscribe that I offer this to you, and I think you're really going to love it. So subscribe there. And that way you will be completely up to date on everything we have going on. So we're going to be probably moving platforms. So we'll totally keep you up to date on everything happening. And that way you can stay up to date with all of our shows and stuff like that. Oh, another cool thing too is if you subscribe to our podcast on iTunes or Stitcher or Spotify for that matter, I think we're on iHeartRadio too, that you can get access to our shows every day. So on Sunday evenings, our latest shows come out, and then every other day of the night of the month, of the week, I should say, around 10 o'clock, 9 or 10 o'clock on every other day of the week, 10 o'clock Pacific, we usually do our best of episodes. So you get a show 7 days a week, and then the new shows are on Sunday night. So you guys are awesome. I just love you guys. Thank you so much. You know, it's a real honor to do this kind of work, and I feel so blessed to be able to do it and to be able to put this kind of work out there. And it's a real dance right now with the censorship happening. And it does feel so good to be able to put some truth out into the world, even though I'm kind of self-censoring, you know, and I think that's why I just want to move away from, you know, YouTube and just be able to, you know, speak freely, because, you know, if you're putting out content, it's really difficult. You know, you're always worried about getting deplatformed. And so it just feels good. And I just feel so honored that you're a part of our show, part of our life. And, you know, for those of you Academy members, like, we talk about you. My wife and I will be in the kitchen together. We'll talk about our Academy members. It's so cool. So much fun. So, all right. Sorry for the long outro, but I just wanted to let you know about all that and really consider getting your oral health fixed. That's the biggest takeaway. healthysmilesforlife.com. I'll put links to everything we talked about at extremehealthradio.com/693. And just a little plea, if you would, I would be grateful for this. If you would just share our show on Instagram, even if it's like a story or a post or something like that. You know, we put a bunch of memes on our Instagram and got flagged big time for that. And I just been really kind of like, I don't even want to use Instagram anymore because, you know, we're just getting flagged left and right. So if you could, you know, and not just for our show too, although I would greatly appreciate it if you shared our show, if it means something to you, but just share anybody's show, you know, share some truth out there with people, and, you know, hopefully people wake up. So that's the goal, right? All right. Love you guys so much. I really appreciate all of your help. You guys are just amazing. Thank you again so much. And thank you again for being a part of our life. And I will catch you on the next episode.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed